All right, welcome back to ABA exam review and the continuation of our BCBA practice question series where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyst.study.com for all of our study materials, including our combo pack. When you pass your exam, please let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A person is trying to improve their financial habits. They notice they frequently make impulse purchases online. They decide that before buying anything not essential online, they must add it to a wish list and wait 24 hours. After 24 hours, they review the item and decide if they should purchase it. This is an example of what? So we're looking at this behavior change intervention, and it looks like a self-management intervention since the person is controlling the intervention for themselves, and we don't see a second social party involved. Now, what is this person trying to accomplish? They want to improve their spending habits, and they notice they make impulse purchases online. So the behavior they want to change is making those impulse purchases. Now, before they buy anything not essential online, they now force themselves to add it to a wish list and wait 24 hours. So the new antecedent becomes add item to wish list or wait 24 hours, and then they can see if they can make that purchase online. So what is this an example of? A, self-monitoring. When we self-monitor, we are just keeping track of our own data or our own behavior. So self-monitoring would simply be keeping track of how many impulse purchases they make, for example. That is not what they're doing here. They are directly intervening on this behavior. B, self-instruction. Self-instruction is just self-talk. It's essentially a self-prompt where you're telling yourself to do something. So if this person told themselves, don't make that impulse purchase, that would be self-instruction. But that's not what they're doing. C, antecedent manipulation. Are we manipulating the antecedent? We are. If we think about antecedent interventions work to prevent behavior. Consequence interventions are reactive. Here, this person is preventing impulse purchases by manipulating the antecedent of the item or seeing the item or the opportunity to make that purchase. Instead of just being able to make the purchase immediately, they must wait 24 hours. And then D, self-punishment. Self-punishment would be a self-administered consequence, but they're not administering the consequence to themselves. They're manipulating the antecedent in a way which leads to the preventing of the impulse purchase. So this is an example of antecedent manipulation. A company wants to increase its employees' adherence to safety protocols. Employees often bypass safety checks to save time, leading to occasional minor incidents. The company decides to implement a new system where randomly a supervisor performs a check. If an employee is observed following safety protocols, they receive immediate verbal praise and a small bonus. If an employee is found to be non-compliant, they receive immediate corrective feedback. This intervention primarily targets what? So this is a long question. It's a fairly difficult question and could cause issues on your exam if you're not attacking the question. Don't rush through long questions. We're looking at the intervention and what it's targeting. We know the company wants to increase adherence to safety protocols. That's the goal. Employees are skipping safety checks and minor incidents are occurring. So the new system is a supervisor performs a check. If the employee is following safety, they receive immediate praise and a bonus, so reinforcement. If an employee is found to be non-compliant, they receive corrective feedback and attempt at punishment. So what is this intervention trying to accomplish? Well, let's just predict, right? One, we know we want to increase adherence to safety protocols. Two, we're trying to use reinforcement to increase those safety protocols through these random checks. Three, we're using direct observation from the supervisor. And four, there is a punishment procedure in place through corrective feedback. So we've got several different ideas in mind. Let's look at A. Are we trying to establish a conditioned punisher for non-compliance? Well, we're already using corrective feedback, which is already in itself a conditioned punisher. So that punisher is apparently already established. So A doesn't seem like the best answer. B, creating a motivating operation for safety protocol adherence. What does the motivating operation do? It changes the value of a consequence. Does the intervention of these random checks change the value of verbal praise and the bonus? Not necessarily. So with motivating operations, you want to be careful. You're looking at the consequence, not necessarily the behavior. And the new intervention is not changing the value of the praise or the bonus. So it's not really creating a motivating operation. C, increasing stimulus control over safety behaviors through reinforcement contingencies. Yes, what has happened here is the opportunity to earn reinforcement is now present. And why is it present, or how is it present? Well, now, when these employees are working and the presence of these different equipments or wherever they are near the supervisor, they now have the opportunity to earn reinforcement for doing the right thing. So the environment is going to start signaling to the employees that reinforcement is available. So stimulus control is going to start to form. And then D, reducing response effort for following safety protocols. No mention of response effort in the question. We only use the information presented. This intervention primarily targets increasing stimulus control over safety behaviors through reinforcement contingencies. Once again, challenging question, but we attacked it. We made some predictions. When we got to the answer choices, it was much easier. A caregiver wants to find out what leisure items a young adult enjoys the most. She places 6 different items in front of him. He picks one and plays with it for a minute, and then it is removed from the array. The process repeats until all items have been chosen or rejected. What type of preference assessment is this? Now, this question is significantly easier than the last one, which is why we don't rush. Not every question is going to be incredibly difficult, and not every question is going to be incredibly easy, but it's going to be, for the most part, balanced if you're ready. In this case, what type of preference assessment? Well, let's start with what do we ask ourselves with preference assessments? We ask ourselves, how many items are we assessing? If we look at free operant, well, that could be infinity, right? Because a free operant is just letting the child lead. Multiple stimulus is going to be 3 or more. Pair stimulus is going to be 2. And if we have a single stimulus, that's going to be 1. In this case, we have 6 different items in front of the young adult. So we know we can eliminate single stimulus because it's 6 items. We can eliminate pair stimulus to forced choice because it's 6 items. Leaves a free operant or multiple stimulus. Well, we know it's not a free operant because we are systematically timing them and then manipulating the array. So if we have 6 items and we have our learner here, let's say they pick 4, we remove that from the array. What do? We rearrange everything. Now we have 5. Did we replace it? We did not. So this is going to be multiple stimulus without replacement. Fairly straightforward question. A behavior analyst is consulting for a community living program for adults with developmental disabilities. A resident, Maria, consistently refuses to participate in scheduled group activities and often throws objects when prompted. An FBA indicates that the object throwing is maintained by escape from these activities. Which of the following intervention components would be least likely to be effective if implemented in isolation? Another long question. What is it asking? It wants to know what intervention component would be least likely to be effective if implemented in isolation. Meaning all these intervention components we're going to treat as if they're happening by themselves without any other intervention. We know the analyst is consulting for this community living program. The goal is to get Maria, who is consistently refusing to participate in group activities, who throwing objects for escape, to likely either reduce the throwing or hopefully increase group activities. Now, the most important thing here is we did an FBA and the throwing is maintained by escape. And why is function important? Well, it's going to tell you how to treat the behavior. The behavior happens for a reason. The reason is the function. The function is telling you what is being gained or removed from the behavior and what's reinforcing that behavior. So in this case, throwing objects is due to escape. Now, which intervention would be least likely to be effective if isolated? A, implementing a DRA procedure for Maria appropriately requesting a break from the activity. Well, we could do DRA by itself, we could replace throwing with something else, and it could be effective, right? So A, only answer so far doesn't seem bad. Anything least or less effective than A. B, systematically desensitizing Maria to the group activity by gradually increasing the duration she is required to participate. Sure, if we do this, if we gradually increase duration that Maria is required to participate, there's a chance that we can start to gain stimulus control over Maria in the group activity setting. More importantly, we're treating the function because we're not letting escape still occur. C, presenting a highly preferred short duration activity immediately before the less preferred group activity. Sure, we could possibly start to reduce the aversiveness of the less preferred group activity or build maybe some behavior momentum, but we're still not allowing escape, so C could be effective. D, requiring Maria to clean up any property destruction for a duration 3 times longer than the time spent destroying the property. Now D still talks about Maria destroying property, and now we're having her clean up the property destruction and at the punishment procedure. But nothing really targets either spending more time in the group or throwing objects less to escape from the activities. The property destruction is still happening, and that's the issue with D. Okay, maybe the punishment is reducing property destruction, but the only way to get to D is to have the property destruction occur. Meaning, if she's throwing these items and we're then making her clean up the property destruction, escape is more likely to occur. Plus, D is a punishment procedure where A, B, and C are not. So if we look at A, B, and C, those are more likely to be effective in isolation compared to a punishment procedure, which really should never, ever be used by itself. A therapist gives a sticker to a client after each correct response. Over time, the client begins working harder during sessions, even when the sticker is not immediately paired with a tangible reward. Why are stickers functioning as reinforcers in this case? All right, so let's think about these stickers and their reinforcing properties. We know the therapist gives a sticker to the client after correct responses. Over time, client is working harder, even when the sticker is not immediately paired with a tangible reward, meaning the sticker is functioning as some sort of reinforcement, even if it's not paired with anything else. Why is that? A, stickers are primary reinforcers that require no pairing. Well, that's just not true. We've got to pair stickers with something, usually a backup reinforcer or an unconditioned reinforcer, to give it reinforcing properties. B, stickers have become conditioned reinforcers. Much more likely is these stickers have been paired with these rewards in the past and the reinforcing properties have transferred over. C, stickers are backup reinforcers in a token system. Well, it looks like the stickers are sometimes paired with the tangible reward. It doesn't seem like we're exchanging for the stickers, so they don't look like backup reinforcers. These stickers function as punishers if the client dislikes them. Maybe, maybe not, but that's not really discussing what the question is asking is why are stickers functioning as reinforcers in this particular case? And the answer is stickers have become conditioned reinforcers. All right, thanks for watching. Some difficult questions today. Hopefully you were able to handle them. Keep working hard if you are struggling. Even if you're doing well, let's keep working and becoming more fluent up to test day. Be sure to subscribe for all of our materials. Check out behavioranalyststudy.com. When you pass, let us know so we can include you in the Sunday shout out. Work hard, study hard. See you soon.